Please watch this entire video before caring for your incision. This video will teach you how to care for your incision after surgery. An incision is a cut made in your skin during an operation. The edges of your incision may be held together with stitches, staples, skin glue, or skin closure strips. A bandage, called a dressing, covers your incision. To prevent skin infections, keep your dressing clean and dry. Taking good care of your incision will help it heal more quickly. Caring for your incision involves cleaning your incision and changing your dressing. Here is what you will need. You will need new bandages, a roll of medical tape, clean scissors, 3 pairs of disposable gloves, 2 clean soft cloths or paper towels, a disposable plastic bag, and a wastebasket. Keep these materials away from your incision to reduce your risk of infection. Prepare materials. Step 1. Wash your hands with soap and water for 1 minute and then dry them with a clean towel or paper towels. Clean hands are the best protection against spreading infection. Step 2. Open a new bandage wrapper. Leave the bandage inside the wrapper and be careful not to touch it. Step 3. Cut 4 pieces of tape and hang them from the edge of a clean surface. The pieces of tape should be the same length as the old ones around your incision. Remove old dressing. Step 1. Wash your hands again with soap and water and then dry them. Step 2. Put on disposable gloves. Step 3. With one hand, press down gently on the skin next to the old tape around your incision. With the other hand, carefully peel away the old tape toward your incision. Step 4. After loosening all of the tape, remove your old dressing. Do not remove any skin closure strips covering your incision. Let them fall off on their own within 5 to 10 days after surgery. If your dressing sticks to your incision, do not tear it off. Tearing it off may cause bleeding and delay healing. Moisten the dressing with warm water. Wait for a minute or 2 until you can easily remove it. Look at your old dressing after you remove it. If the dressing has a foul or sweet smell, or it has a yellow or greenish stain, call your healthcare provider. Step 5. Place the old dressing in a disposable plastic bag. Step 6. Remove the disposable gloves. Throw the gloves and the plastic bag containing your old dressing in the wastebasket. Clean the incision. Clean the incision only if your healthcare provider says you should. Your healthcare provider may only want you to change the dressing. Make sure you understand what your healthcare provider wants you to do and be sure to call with questions and concerns. Step 1. Wash your hands with soap and water and dry them. Step 2. Put on a new pair of disposable gloves. Step 3. Always use a clean cloth, warm water, and if your healthcare provider says you can, a mild antibacterial soap to gently remove dried material from the area around your incision. Start with the areas nearest your incision and wipe outwards or away from the incision. Use a different part of the cloth each time you wipe your skin. When the cloth is dirty, use a new clean cloth. Do not scrub or remove any scabs. Scabs protect your incision while it heals. Allow them to fall off on their own. Do not wipe over stitches, staples, or skin closure strips. Unless your healthcare provider says you should, do not clean your incision with alcohol, iodine, or peroxide. Step 4. Let your incision air dry. As it air dries, check your incision for the following: stitches or staples that are out of place, the edges of your incision pulling open, bleeding around your incision, redness that extends more than 1 inch from your incision edges, increased skin warmth around your incision, swelling around your incision, foul or sweet-smelling odor, white, yellow, or green discharge coming from your incision. Call your healthcare provider if you notice any of these changes. Unless your healthcare provider says you should, Do not use ointment, lotion, or powders on your incision. Step 5. Remove the disposable gloves and throw them away in the wastebasket. Apply new dressing. Step 1. Wash your hands with soap and water and dry them. Step 2. Put on a new pair of disposable gloves. Step 3. Pick up a gauze pad by one corner. Do not touch the side that will be next to your incision. Carefully cover your incision with the gauze pad. You may need more than one gauze pad if fluid is still coming out of your incision. Step 4. Hold the gauze pad in place with one hand and tape the gauze pad to your skin with the other hand. Make sure you seal all 4 edges of the dressing. If your skin is red from the tape of the old dressing, put the new one on a different part of your skin. If your skin is swollen or has blisters, contact your healthcare provider. You may be allergic to the tape and need to try a different kind. Step 6. Wash your hands with soap and water and dry them. It's normal to see mild redness and swelling around your incision edges or a clear or pink discharge. However, you should contact your healthcare provider if the shape of your incision changes. Also, call your healthcare provider if you have nausea, vomiting, diarrhea, or a temperature of 101 degrees Fahrenheit or higher. To prevent skin infections, keep your dressing clean and dry. Taking good care of your incision will help it heal more quickly.